Hi, my name is Melanie Mora, and I'm going to talk about gastrointestinal complications of granulomatosis with polyangiitis. Definition: granulomatosis with polyangiitis (GPA), which is also known as Wegener's granulomatosis (WG), is a necrotizing granulomatous vasculitis with small arteriovenous and capillary involvement. Applications in medicine: granulomatous vasculitis is a necrotizing small vessel vasculitis, and granulomatous inflammation is strongly associated with anti-neutrophil cytoplasmic autoantibodies. The typical clinical manifestation is a triple syndrome, that is, upper respiratory disease, pulmonary inflammation, and glomerulonephritis. Gastrointestinal tract involvement is uncommon and is usually found at autopsy. The types of lesions mainly include submucosal edema, ulcers, hemorrhagic mesenteric ischemia, intestinal obstruction, and perforation. The diagnosis of gastrointestinal complications depends largely on the clinical manifestation. Study on patients with systemic necrotizing vasculitis that involve the gastrointestinal tract found that the most common symptoms were abdominal pain, 97%, nausea, vomiting, diarrhea, bloody stools, and melena. The location of GPA lesions in the gastrointestinal tract are diverse and can involve all parts of the intestine. The most common pathological manifestations are ulcer, intestinal necrosis, and perforation. Conclusion: when GPA patients suffer from abdominal pain, diarrhea, bloody stools, or melena, the differential diagnosis should be made while taking into account the possibility of granulomatous vasculitis involving the gastrointestinal tract. Colonoscopy combined with tissue biopsy can help to determine the nature of the disease and provide an effective method for differential diagnosis.
Hi, my name is Dr. Les Mertz, and I'm a rheumatologist at the Mayo Clinic in Arizona. I would like to tell you about an autoimmune disorder called ANCA-positive vasculitis and a new study that the Mayo Clinic is participating in at this time. Most of you already know something about the immune system. When the immune system functions normally, it helps to fight off viruses, bacteria, and cancer cells. When the immune system functions abnormally, you may develop unusual infections or damage to the normal cells and tissues of your body. Autoimmune disorders develop in such circumstances, and you already likely know about some of them, including rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, scleroderma, and vasculitis. One of the most common types of vasculitis is ANCA-positive vasculitis. ANCA stands for anti-neutrophil cytoplasmic antibody and represents the antibody that can be found in your blood when you have one of these conditions. There are actually three of these, including granulomatosis with polyangiitis, previously called Wegener's granulomatosis, microscopic polyangiitis, and eosinophilic granulomatosis and polyangiitis, previously called Churg-Strauss granulomatosis. If you have granulomatosis with polyangiitis or microscopic polyangiitis, your doctor will likely prescribe medications that suppress the immune system to reduce the inflammatory damage that may occur to your tissues and organs. These medications may suppress the immune system enough that you will actually develop an infection or be at increased risk of developing a cancer. In April of 2001, the FDA approved a new treatment for granulomatosis with polyangiitis and microscopic polyangiitis. Since it is a relatively new treatment, the pharmaceutical company is sponsoring a study to help determine even further the benefits and side effects of this new treatment being used for treating patients with ANCA-positive vasculitis. Our 3 Mayo Clinic campuses in Arizona, Florida, and Rochester are participating in these studies, and you might be a candidate to participate in them if you have granulomatosis with polyangiitis or microscopic polyangiitis. You may review the details of this study on the internet at clinicaltrials.gov by searching ANCA and observational studies, or by typing in the identifier number, which is NCT 016-13599. In this study, you will be treated according to your doctor's best strategy. A 4-year follow-up period of time is planned to record benefits and side effects that occur of this new therapy. Thank you.
Granulomatosis with polyangiitis, previously known as Wegener's granulomatosis, is a rare disease. It is a type of vasculitis, or inflammation of the blood vessels, and the inflammation limits the flow of blood to important organs, causing damage. It can affect any organ, but it mainly affects the sinuses, nose, trachea, windpipe, lungs, and kidneys. The cause of this health condition is unknown. It can affect people at any age, and men and women are equally affected. It is more common in whites, and symptoms may include joint pain, weakness, tiredness, and cold symptoms such as a runny nose that does not get better. Doctors use blood tests, chest x-rays, and biopsies to diagnose GPA and rule out other causes of the symptoms.